The unintended consequences of health care reform continue to crop up as the provisions roll out. Most recently, a report that children might be getting hit hardest. Congressman Bill Cassidy is a Republican from Louisiana who also happens to be a doctor. Dr. Cassidy, welcome. Good to see you, sir.
Hey, Jerry. Thank you for having me.
You know, we have talked so much on this show about health care. The Republican Party wants to repeal it. It's part of your agenda. You announced. How the heck do you repeal such a big law?
Well, obviously, if we first propose repeal, most likely the president will veto. On the other hand, you then go back and defund or repeal small, potentially very onerous provisions. Finally, since it's so interrelated, you end up with something which I call Swiss cheese, and with something which has the structure of Swiss cheese. At that point, it becomes, if you will, necessary to keep what is good but to replace what is bad, and that's when you can actually replace. That's the hope.
Swiss cheese, that sounds really unpopular, I have to say. Well, let's talk a little bit about the unintended consequences of this law. As we see it roll out, a lot of things are happening. Just this week, a couple of insurers said, hey, we're not going to underwrite care for single children, for children alone, because it's going to cost us too much money. Increased Medicare costs, increases insurance premiums. We just saw premiums announced by many companies up 20, 30, 40%. It's going to force small business layoffs. When you look at this bill and the unintended consequences, can we even sustain having this bill become law as it rolls out over the years?
Clearly, the unintended consequences and, frankly, the intended consequences will be something that can have an incredibly negative impact upon our economy. Now, if we talk about an unemployment rate that is stubbornly staying up, that is in part because, as Peter Roscom said, the uncertainty created by this bill and the regulation and other bills and regulation are inhibiting employers from hiring. So, yes, can we muddle through? Absolutely, can we muddle through. Are we going to knock down our unemployment rate? Are we going to return to economic vibrancy? Probably not.
Congressman, I want you to listen to something the president said yesterday and respond to it. Here's President Obama.
We couldn't ignore it because the cost of health care has been escalating faster than just about anything else. And I don't need to tell you all that. Even if you have health insurance, you've seen your co-payments, your premiums skyrocket. It was bankrupting families, companies, and our government. So we said we had to take this on.
So, you know, part of this is all true. You know, costs did rise dramatically. It bankrupted some families. What's the solution? You don't like this law. What's the solution?
Clearly, reform was necessary. On the one hand, on the other hand, there are fundamental differences in how you approach reform. Do you take a top-down approach where you expand Medicare, which is going bankrupt in 7 or 8 years, and expand Medicaid, which is bankrupting states, and you cannibalize the one, you expand the other to create a third entitlement, which is supposed to rescue the first two? I like to say if that makes sense, it shouldn't make sense, but that's what this policy does.
Well, Congressman, what would you do, though? I know you don't like what the president has done. Give me the shorthand version of what we should do.
Something we call a patient-centered approach, one example of which are health savings accounts, in which you begin to allow people to have ownership of their health insurance policy. Instead of putting up $12,000 to $15,000 a year for a policy, and if they don't use it, they lose it, they sluice off a certain amount of that premium into an account that they control. And with that, it changes the psychology. Now they become wiser purchasers of health insurance. And studies show these policies are 10 to 30% cheaper than traditional insurance policies.
Quick answer. You're a doctor. You know what the system's all about. You've been inside it. Can we reform this without bankrupting the country?
Absolutely. And in fact, it's imperative that we reform it without bankrupting the country. I used to tell my patients, your financial health is just as important as your physical health. We must pay attention to both. I think we must do so as we go forward.
Congressman Cassidy, thanks for your help today. We appreciate it.
Thank you, Jerry.
The Bell, California